Because, Madam Chair, I don't want to be talking about this next year. That's, I just don't want to be talking about it next year. I want another issue. And but we sincerely want this project started and completed, and we're doing everything we can to ensure that that happens, and we will continue to do that. And I don't blame the honourable member for being frustrated. I'm extremely frustrated myself.
The honourable member from Richmond.
Well, Madam Chairman, I'm pleased to hear the minister say that, and there has been some problems, but what we've been left, the municipal council, myself and others been left, is to wonder what is the political direction being given to Department of Health staff, and how much of a priority is this being said to them? Or is it just one more item on a list of, I'm sure, a ton of items that Department of Health staff have to deal with on a regular basis? What priority is being given to this? That is the issue that we're left to ask ourselves. And I remind the minister again, at the end of the day, you are the single largest department of government. You're the single largest department of a $5.4 billion corporation. It is unacceptable to allow land issues to become an issue when you're the province of Nova Scotia and you're the government, and you're saying we're allowing land issues to be a concern. Who in a better position to expropriate land than the province of Nova Scotia and the government, if so need be? If it was anybody else, I could sympathize as a lawyer and say, well, yes, it's a difficult position you're in, and if there's problems with the land, it's hard to clear it up. You're the government. You're the Crown. Who better than the Crown to take care of these issues? And yet, we continue to see these delays. And then arguments over the design. Is this the first nursing home that we're building in Nova Scotia? I would think not. So how can we allow design problems to hold up for 6 months and there be argument? Yet, let me put another issue to the Minister of Health. Not that I want to reopen the whole design issue, but one issue that's being asked now by the people, the residents, the staff at the Richmond Villa. The fact is that we realize Richmond County has an aging population. They're not getting any younger. Yet, right now the Richmond Villa is full. I believe it has 75 beds. The new facility would have in the range of, I believe, 62 beds or 65 beds, a reduction of over 10 beds. I wonder if the minister could explain to the people of Richmond County what logic was used by his department, knowing the demographics of Richmond County, knowing the amount of people that are on a waiting list right now to get into this facility, knowing that they hardly ever have an empty bed, why they would suggest building a facility with less beds than what exists right now.
The Honourable Minister of Health.
Thank you, Madam Chair. And just to go back to the previous discussion and update the honourable member, the purchase of the land has been complete and it is in the hands of the appropriate owners at this time. And the design is prepared to, is ready to be presented to the board, and I understand that they will be considering that at their next meeting, and that should be the last hurdle that would be required. The determination of the number of beds in the new facility is based on the planning process, and that planning process involved the local, the people interested in the local community relative to the expected needs in that area. So it is the result of the planning process that took place there.
The honourable member from Richmond.
Well, I have to agree with the Minister of Health. While he doesn't want to be talking about this issue much longer, nor do I. I sincerely don't. Nor did I want to be talking about closures of the emergency room at the Straight Richmond Hospital as often as I had to. It was not an issue which I like talking about. Finally, we do have some stability for the time being at that facility, and I hope that continues. But, Madam Chair, my big fear is that once this facility will be built, within a few years, within possibly the first year of it being open, the reaction will be, it's not big enough. The waiting lists are too long, and there's not enough beds at that facility, which would be extremely unfortunate. And I know more and more people are questioning the planning process that went in that would result in a reduction of beds. But at the end of the day, Madam Chair, right now the residents of Richmond County will take any new facility right now. It was very difficult this winter after receiving calls from the families of residents in there that their parents and their and their loved ones were frozen in the Richmond Villa during the cold spell that we had because the heating system just could not keep up. Yet they kept asking, when will we get the new facility? Where is it? How much longer do we need to wait? How much longer do we need to be patient? And it would have been so easy as an opposition politician to get up and go in the media and criticize this government from one end to the next on what it's been doing for this facility. Yet we've all tried to hold our tongues, to be optimistic, whether it be the municipal council, whether it be the staff at the facility, whether it be their families. Yet my only hope today is that the minister clearly appreciates the frustration involved here at all levels. He indicates he's frustrated also. I submit to him there's one person that can take care of that frustration, sir. And if you're not familiar with him, I encourage you to find the nearest mirror and introduce yourself. That gentleman can take care of this frustration. He can take care of this problem. If he gives the political will, I've heard his booming voice on his radio ads. It is intimidating. It's scary. More than one person fell out of bed hearing his radio ads in the morning at 8 o'clock when the big voice came on. But anyways, it got him elected somehow, so I encourage him to use that same voice with his bureaucrats and make it clear this is a priority. He is frustrated, and like all of us, he wants to get rid of that frustration for the best interest of the people of Richmond County. With that, Madam Chair, I thank the Minister for his responses. I will pass over the remainder of my time to my good friend and colleague, the member for Victoria the Lakes.
The Honourable Minister of Health.
The honourable member had to say. And first of all, Madam Chair, I would say that I'm sorry. Oh, no, I've had that conversation, yes, a number of times. I would like to say that the honourable member indeed has been reasonably cooperative with respect to this. He's not shared his frustrations in a public way, and I think that's because he has a pretty good understanding of the real difficulties that have been encountered with respect to the project. And it doesn't matter what the volume of my voice is, Madam Chair. There are circumstances when that approach is not an appropriate approach. There are circumstances when the nature of the problems are such that they need to be worked through, and I'm becoming reasonably satisfied that they are in fact being worked through. I do want to add something to what we said about the numbers with respect to Richmond Villa. There are a number of clients at Richmond Villa who come from jurisdictions outside of Richmond, and those clients will be repatriated, and the projections are made based on the demographics of the community for which the facility has been designed to serve.
The Honourable Member from Victoria the Lakes.
Thank you, Madam Chair. I'd like to take the time allotted to myself to focus on a proactive approach for the healthcare problems in the province. And with that, I'd like to focus on chronic diseases that an estimated of 40% can be prevented through a proactive approach, and active is the operative word. I remember when my group in my community, we put on a health fair, and through the officials that came there, we were informed that there were 2 people on the preventative side, one in Antigonish and one in Cape Breton, and there was 50 people employed on the cure side. And it's kind of the wrong approach. I think we should try and look after our health while we're healthy, rather than trying to cure it after we get sick. And what I would like to do is just, on behalf of the Nova Scotia Heart and Stroke Foundation, just issue some reminders and use some statistics, Madam Chair, that physical activity, over 55% of the residents in Nova Scotia are physically inactive. And 1 in 10 students, by the time they get to grade 11, they need activity. The gymnasium, as we used to call it, or going to gym, is not even mandatory anymore in school. And 15% of high school students, that's all that take physical education, Madam Speaker. Madam Chair, I mean. Let's go to some areas. Let's talk about obesity. 27.9% in Lunenburg. Why down there? Shelburne, Queens, and Lunenburg counties. 27.9% people are obese. 47% of Canadians, almost half of Canadians, overweight or obese. 6.8% of the provincial health budget going $120 million a year going toward the health of preventative measures when it could be going into proactive courses. One thing I must say, that the strategy that the Honourable Minister of Health Promotion announced today is a point in the right direction. And I see the Honourable Minister and his colleagues there with a smile on their face. I guess they're probably looking at me and saying, here he is talking about being obese, and look at himself. I'll use myself as an example. I won't point to the minister over there on the other side. I think there's more booming for the minister than his voice, Madam Chair. Let's talk about some economics. $3 billion in medical care costs with chronic diseases account for 60% of the total of medical care expenditures. I mean, and $247 million physical inactivity costs the Nova Scotia economy. What we would do with $247 million. 7.5 million. 10% fewer Nova Scotians are physically inactive. I mean, it's look, we have a population of lay down, eat your French fries, and watch the TV. And we're paying for that. If we took $1 billion tomorrow and put it into the healthcare system, it wouldn't resolve the problem. Because the focus is on the cure, not on the preventative side. And hopefully over a period of time, if we were to take, for every dollar that went into the preventative side, if we took $1 away from the cure side, I mean, and put it into the preventative side, and eventually swing the tables the opposite way so that there was more emphasis on prevention than on cure, then hope, and the prevention side is going to save the dollars. So therefore, with the same amount of money that's in the budget, and the reducing of the costs through people being more physically active and more healthier, then the money could be put to better use. I'll just focus on stroke. And these figures, by the way, are from the Nova Scotia Heart and Stroke Foundation. About the 2,800 deaths per year from heart disease, 36% of all deaths, the biggest killer in Nova Scotia, cardiovascular disease. And one would think off the top of their head that it would be cancer. $3 billion in health care costs for Canada alone because of inactivity and mainly resulted in the institutionalization, which results from strokes. $250 million in health care costs for Nova Scotia. Circulatory diseases. It's all basically, not all, but an awful lot of it can be pointed to inactivity. And as I say, Madam Chair, the focus is always on the cure and never on the prevention. The statistics that I quoted are all legitimate, Madam Chair. They've come from the Hospital Morbidity Database, Canadian Institute for Health Information, and a report on the Nova Scotia Integrated Stroke Committee. These are all legitimate statistics that I quote. But what I want to do is show the example, that the proven example that was given by the Nova Scotia Heart and Stroke Foundation in their using of the example of the North Karelia project, which North Karelia is located in the eastern part of Finland, and it took 30 years to get to where we are today with their statistics, but with having the example put before us, we have something now to follow that's been tried and proven correct. Then we should take no more than 10 to 15 years to achieve basically the same results. The statistics that they've provided us with and the results are almost staggering. Over there, they passed anti-smoking laws, which we are doing in Nova Scotia, Madam Chair. The dietary transitions were supported by the Finnish food industry in creative ways that they would reduce the low-fat products and provide, instead of giving somebody a product that was saying supposedly low in fat, they gave them a salad, Madam Chair. Given the they created the emphasis on improving health and they supported the community at a community level. The unprecedented results, Madam Chair, over a 30-year period were as follows. Cardiovascular disease mortality rates declined by 68%. Madam Chair, that's far exceeds 50%. That's a phenomenal success rate. Coronary heart disease mortality declined by 73%. Another one way over the 50% mark, staggering figures of success. Cancer mortality declined by 71%. All-cause mortality declined by 49%. I mean, the figures are almost unbelievable. Approximately 3,800 premature deaths in North Karelia and 50,000 deaths through all of Finland were prevented, all by changing their diet and becoming active participants in everyday living. Social costs generated by cardiovascular disease in Finland have decreased annually by $100 million US. Now, I'm sure the Honourable Minister would like to have $100 million US every year to put in his budget and maybe help with the ads that he has on the radio. But all insinuations aside, Madam Chair, $100 million of a saving is phenomenal. Social costs generated by cardiovascular disease in North Karelia have decreased annually by 40 million. And we got individuals over the age of 35. And then the 60 million was saved for the group 35 to 64. So, Madam Chair, imagine what we could do with the health care budget if we could save anywhere near 5 or 10% of our budget each and every year over a period of time until we could amass the figures that I've just quoted here. And maybe eventually get to the point where we could provide more health care for less dollars than we're spending right now. And the dollars that would be over and above could go into more and deeper community projects and maybe hopefully surpass the figures as shown by North Karelia. And I want to just compliment the Nova Scotia Heart and Stroke Foundation for their success in what they're doing, and compliment the Minister of Health Promotion because he announced today, and it's a good start to going there to reduce the health care costs. And I'm just wondering what the Minister would reply to if he wanted to comment on that. But the cost of the physical inactivity in Nova Scotia is...
Would the Honourable Minister of Health like to make a closing remark before we move on? No, to the next speaker. I thought I heard a question at the very end there, but maybe I didn't.
I guess, Madam Chair, you're anticipating that the time is running out relative to this.
It has run out.
There indeed is, I'm sorry? Yes, I understand, but you then go to the NDP. So I don't want to be answering his questions when I should be answering their questions, and I'm wondering if the honourable member would be satisfied if, when we go back to them, if I would to take some time to address the concerns that he raised, because there is a considerable amount that I would like to say about it, and I don't think there's enough time left in your allotment for me to adequately address that at this time.
Thank you. The honourable member from Halifax Needham.
Thank you very much, Madam Chair. I'd like to start. When I was last speaking to the minister about the health estimates, I was looking primarily at acute care, and I'd like to finish off in that area somewhat before I move to long-term care, where I have some questions. I've noticed yesterday we've received the public accounts, the supplement to the public accounts for last year. And in that, on page 72, it indicates that there were out-of-province claims of approximately $17.3 million. And out-of-province claims in U.S. claims of $400,000. Now, I I think we all appreciate that from time to time, residents of Nova Scotia require services out of province. For example, the loss of the liver treatment, the liver transplant program over at the QE certainly would be a feature of this, I would assume. But this is a very large figure of expenditures for out-of-province claims. So I'm assuming that a fair number of Nova Scotians have been treated for health care services in other provinces. And I would like to ask the minister if he could provide some more detailed accounting of what's occurring and why it's occurring in these areas, both in terms of out-of-province claims in other Canadian jurisdictions and in American jurisdictions.
The Honourable Minister of Health.
Thank you, Madam Chair, and I want to thank the member for the question. And I don't have the kind of detail that she's looking for with me at the moment. We'll be pleased to get it. We can give a breakdown by jurisdiction, that is areas that provided the service to us, and we should be able to have something to say about some of the nature of the claims that were addressed relative to that. I would ask for the member's indulgence to be able to put that information together. The amount of money paid out for claims for services provided to Nova Scotians outside of the province is $17.3 million, and for claims in the U.S. jurisdictions is an amount of $474,000. But as to the breakdown and the detail of that, we'll provide that at a later date.
The Honourable Member from Halifax Needham.
Thank you. Well, I'll be looking forward to seeing that information. I think that, you know, certainly it's something that we need to be concerned about, because I think it will indicate what areas of healthcare services we're unable to provide in our own province. And perhaps it's you know, understandable that we won't be able to provide every service, but I think that the principal assumption for Nova Scotians is that we have a comprehensive healthcare system that's able to meet their needs, except in the very extenuating kinds of circumstances. I have two other questions that come from the supplement to the public accounts, and I'll tell the minister he'll be relieved I haven't added up all of the places where coffee and sandwiches were ordered in. Although the Department of Health could rival the Department of Education in this regard, I suspect, if I did that. At any rate, what I want to ask about is the Nova Scotia Health Research Foundation. The Nova Scotia Health Research Foundation, in the supplement to the public accounts for last year, indicates $2.5 million in expenditure. Yet, in the estimates, the supplementary detail, the Health Research Foundation grant every year has been for $4.5 million, estimated, forecast, and you know, it continues on. So I want to know, why is there this discrepancy of $2 million that appears between the estimates and the actual expenditures?
The Honourable Minister of Health.
I want to thank the honourable member. It's important to bear in mind that the supplement to the public accounts is for the year 2002-2003. The figures that we're dealing with in the current budget are 04-05, and the amount of money that was expended in 02-03 is 2.5. The estimate for 03-04 was 4.5, and the amount that is budgeted for this year is 4.5. Okay.
The Honourable Member from Halifax Needham.
What was the other thing? Oh yeah, the other point I want to make with respect to claims, I would say, we also have to bear in mind that when you travel to another Canadian jurisdiction and you receive treatment at a time when you're traveling, that shows up in that particular figure as well.
The Honourable Member from Halifax Needham.
Thank you very much. Yes, indeed, that's unfortunately the case sometimes, I think. I have a question about Quick Card. On page 76 of the supplement to the public accounts, there is an expenditure for Quick Card TM Solutions, Inc. in the amount of a little more than $400,000. Almost $445,000. And if you look in the Department of Community Services, and I understand that's not your department, but Quick Card also shows up there with an expenditure of a little more than $110,000. Now, I understand this is a company that the Department of Community Services is using with respect to the administration of a dental program for persons who are in receipt of income assistance. So I'd like to know, this is quite a significant expenditure to this company from the taxpayers of Nova Scotia. So I would like some information about who this company are and what it is that they provide to the Department of Health for this particular line item.
The Honourable Minister of Health.
Thank you, Madam Chair. The particular company to which the honourable member refers is a company that's not unlike ABCC, Atlantic Blue Cross Care. Yesterday I was calling it corporation, but it's Atlantic Blue Cross Care. And they administer for us the dental program for children, which is a line item with respect to the Department of Health. The Department of Community Services uses the same firm, but theirs, of course, is for clients who are in receipt of community services and would receive dental services. So that is the service that they provide for the Department of Health.
The Honourable Member from Halifax Needham.
Well, thank you very much, and I want to thank the Minister. And that brings me then to the Children's Dental Program, which last year, or the fiscal year we're currently in, was estimated to have a budget of $5.4 million. And next year, the estimate for the Children's Dental Program is only $4.692 million. And I want to ask the Minister, why on earth would we reduce the amount of expenditure for children's dental health in the province of Nova Scotia? And I want to know what kind of value for service we're getting from this private company in terms, it's a rather large expenditure for the monitoring or the administration of the children's dental program. And you know, I have some questions about this government's priorities, I guess. in terms of our commitment to our children and our children's future. We have, you know, the Premier and various ministers making announcements every day. You know, we're going to improve the recreational opportunities of young people so that they'll be more healthy. We're going to, you know, make access to our schools so that they will have more recreational opportunities to be more healthy. Yet at the same time, we're actually reducing the expenditures for the children's dental program, which is a very important program. It was a program that your government actually reduced when you initially came to government, and there was some partial restoration of services, but now again it looks like this is a program that will sustain a certain amount of reduction in services to families. So I want to know what your justification is for this decision.
Minister of Health.
Thank you, Madam Chair. The honourable member really, there are two issues that she raised in her comments. The one is with respect to, what is it, Quick Card? Quick Card. That company was given a contract. The services used to be provided by ABCC. It's been determined that they are able to provide it more efficiently at a cheaper cost, and so we went to them in order to provide that service. The second item, if the honourable member would consider the estimate for 0304, you'll see that the estimate was $5.4 million. However, if you look at the forecast for 0304, the forecast is for $4.5 million, and that reflects the usage of the program, i.e. the demand that exists for the program. And we feel quite confident that the estimate for this year of $4.7 million approximately, it will be sufficient to meet the demand on that program as we move forward. There simply are fewer children demanding the services under the program. That does not in any way reflect a reduction in the service that is provided under that program.
The honourable member from Halifax Needham.
Thank you very much, Madam Chair. Well, I can appreciate what the minister is saying, but I guess I would say to the minister that perhaps you and the Minister of Community Services need to get together and have a discussion about the underutilization of the children's dental program. And I say this for the following reason. I've had numerous calls from people throughout my constituency, but not only in my constituency, in other constituencies as well. I can think of one particularly compelling situation that came to me from the member of Halifax Atlantic's riding, where a constituent from Halifax Atlantic was very concerned because his daughter, who's a single mother with young children, had run into a situation where his grandchildren, in this case, required dental work, and in fact received dental work, but did not have the cost of the dental work covered through the Department of Community Services vetting program, which essentially went through Quick Card. And in this situation, this family required additional work, and they were deterred from seeking the services that they required, even though the dentist was recommending that the child needed these services. And these are children who did fall within the parameters of the children's dental program, and yet they were unable to secure services. So I think this is an area of concern. When you have such an important feature of our healthcare as dental services, then I think it is very important that we make available these programs. And if we're underspending in those areas, then I think certainly when you think about families with low-income kids and single parents who are working and maybe in and out of the labor force in the kind of work environment that we now have, which is pretty well a revolving door for a lot of people in terms of the kind of instability in employment that often exists. We need to make our programs very flexible and capable of meeting the needs of these children. So I would hate to see us reduce this money that is available without really addressing the fact that there still is an unmet need in our community and in our province in the children's dental area. So I just need to say that and leave that at this point and look at another area. It's not something that really requires a response. I want to go to long-term care, and I want to ask the minister some questions about what the future holds for long-term care. I want to start by saying that when I first came to this place, approximately 6 years ago, there was a moratorium on adding beds, long-term care beds, into the system under the McClellan government of the day. And although your government has lifted that moratorium, very few new beds have been actually added. And of course, we've seen the public debate around the financial assessment. Last year, your predecessor, the then minister, the Honorable Jane Purvis, on the 7th of April, I will table this news release when I finish, came into my constituency, Halifax Needham, Northwood Manor, wonderful long-term care facility, and made some announcements about what the government's plan was at that time, which was to put an additional amount of money into the long-term care system. And part of that was to pick up, the province to pick up a certain portion of the daily per diem. And to have that then annually until the year 2007 increase so that in fact there would be some relief for seniors, particularly those seniors who were self-paying. So the first portion of that subsidy came into play, but I believe that it was at that time announced that there would be, in April of this year, a further portion of that come into play. With the announcement of the government's taking over of the health care component of long-term care as of January 2005, I wonder what is the plan to continue to pick up that additional portion in this transitional period. So I guess maybe I will ask, will the government pick up as was planned in this announcement last year, or is this now in doubt or in flux?
The Honourable Minister of Health.
Thank you, Madam Chair. If I could just for a moment go back to the previous discussion, and I just want to make it clear that the criteria relative to the children's dental program is the only criteria is an age criteria, and if you're 9 years of age and under, you're covered by the province's children's dental program. So that the circumstance to which the honourable member refers is one that that I don't quite follow if indeed the children were within the appropriate age group. If they were beyond that age group, then and they were clients of community services, then the minister was here when she raised the issue, and I'm sure he'd be pleased to address it at the appropriate time. What was announced by my predecessor is a program that was intended to be phased in over a period of 4 years. And the initial payment of $12.75 per month of assistance toward residents of long-term care facilities is something that $12.75 a day is something that was intended to be increased beginning this year as we moved with the implementation of a 4-year program. The budget made it clear that because of the government's ability to find resources, that we intend to implement full coverage beginning January 1 of 2005. What we will be doing is continuing the $12.75 per day subsidy until January 1 of 2005. But because we have announced a new program, then the rest of the staged implementation of the previous 4-year program will not be implemented.
The honourable member for Halifax Needham.
Thank you very much, and I want to thank the minister. Okay, that clears that one up. The next question is around the personal use allowances. The personal use allowances have been at $105, and so there's been a decision taken to increase those personal use allowances to a minimum of $150, if I read the budget correctly. I want the minister to tell us when will this new practice with this new amount of money go into effect for people who are in nursing homes? When will they start receiving an increase in their personal use allowance? I want to know what the department's thinking is with respect to the personal use allowances after the health care costs are taken out of the seniors' responsibility. So after January 1, will seniors and others who are in nursing homes be left with money that they currently have for their personal use? And I want to ask about the department's policy with respect to the restrictions on how that money can be used, whether or not the department plans any kind of process that will consult with residents and seniors in the homes with respect to the parameters for the use of personal use allowances.
The Honourable Minister of Health.
Thank you very much, Mr. Chair. What will happen in January 1 of 2005, we will no longer have what we describe as a personal use allowance. In fact, residents will be able to retain from their income an amount of money, the minimum of which would be $150 a month. So it's not an allowance or anything else. It's simply that amount of money that they will be able to keep, and it goes up to I guess 10%. 15%. Yeah, and so the minimum amount is $150. So it's no longer what you would describe as a personal use allowance after January 1 of 2005. From now into the future, the current personal use allowance does not have any restrictions on it in terms of how residents are able to use that money. So those restrictions have been removed. So with respect to the issue of consultation, what we're saying is there are no restrictions, so there is no need to consult relative to what it would be. So from now on, there aren't any restrictions on the personal use allowance. From January 1 on, it's simply a matter of people retaining their income to use in whatever manner they see fit.
Thank you very much, Minister. That's great. That does clarify the plan. I have some questions around how the per diem is actually going to be established. And certainly, this is the room and board per diem in the homes for special care. And I'll also like to table a piece of information that I've been given that shows that Nova Scotia has the highest cost, per diem costs, for long-term care and residential services in the country. And the per diem costs range from $110 a day to $199. And as we all know, the cost to be in these continuing care facilities is extensive. There has been some speculation that, and some musing, I don't know if you read Peter Duffy's column in the Herald. He had a little piece where he indicated that perhaps what would happen is that the room and board portion would not be controlled in any kind of way, and that this would place quite a serious burden on seniors and their families. And certainly, with the seniors population and people who are very interested in knowing exactly what's going to happen the 1st of January, there is a lot of discussion about how do you establish the room and board component and whether or not it will be a manageable component. And given the already large costs, the per diem costs in the province of Nova Scotia, and the fact that we do have the highest per diem costs of any province in the country for residential care and long-term care services, I want to ask the minister how you're going to approach this and what kind of assurances can you give to the public and to Nova Scotians that the room and board costs will be fairly set, they will be, that you will take the kind of approach to establishing the per diems in these private facilities as you've applied inside of some of your own programs and departments in terms of making people count the paper clips and make sure that there isn't a lot of excess expenditure where it doesn't have to be that gets passed along to seniors and their families.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair. I had a look at the same column to which the honourable member refers, and I can say that the circumstance that was described in that column is not what will be happening within this province, because we will still set the per diem charge relative to room and board for residents of long-term care facilities in this province. And again, just another cautionary note, I guess, when it comes to doing comparisons of one jurisdiction to another. In this province, you're looking at the total cost of room and board plus health services as it is now provided. And the determination of the appropriate breakout of that is something that of course we will have to do in determining the amount that we would charge for room and board. But I will say that is an amount that will be determined by the department, be part of our responsibilities. And I can also indicate to the honourable member that it is something that would be reviewed on a continuous basis. We should not in any way assume that we're going to be dealing with a static figure, because costs do change, and it's appropriate for those figures to be recovered.
So we're going to still set the rates.
Yeah.
We have control.
Yeah, we will retain total control. We'll be setting the rates, and we have control over the budgets. And the figure will be an average figure for room and board across the province when it's implemented.
Thank you. The honourable member for Halifax Needham.
Thank you, Mr. Chair. Not so long ago, the Deputy Minister, Dr. Ward, was at the Public Accounts Committee, and he spoke at that time. I can't remember if it was here on in the chamber, if it was outside to the media afterwards in the scrum, but he certainly talked about the need to consider smaller residential options rather than large residential or institutional settings for continuing and long-term care. He indicated that other provinces are looking at this, and he indicated that certainly other jurisdictions around the world have these kinds of arrangements in place, and that it was his feeling, I don't know if he was signaling, a shift in government policy in some ways, or the beginning stages of a dialogue, that probably needs to occur around modernizing long-term and continuing care. That this is something that we really need to talk about. So, what I want to ask the minister about is, where do small operators fit into the reorganization of long-term care now that the healthcare component will be picked up by the department? And there's some suggestion in the budget speech that a process for engaging in this, the overhaul of long-term care, to modernize it, to bring in better standards, to look at to look at the most appropriate deliverer of services and what have you. Where do small operators fit in this process? And I specifically refer to those groups of homes, seniors' homes, primarily seniors' homes, that from time to time have been in the news for violations of fire regulations, and where there have been questions raised about whether or not they are an appropriate provider of services to seniors and people who are, in need of a more residentially based kind of living situation. So could you tell me if that's part of the plan, if there is a plan?
Thank you. The Honourable Minister of Health.
Thank you, Mr. Chair, and thank the honourable member for the question. When you look at the province and the distribution and the demographics of the province, we have areas of the province where citizens who might want to receive the level of care that can be provided in a nursing home may not be able to receive that without having to be, in a very significant way, relocated outside of their homes. And I relate that particular situation simply to point to the need for us to be doing some strategic long-term planning as to related to how we go ahead and provide services in the future. And you know, obviously, if we were to try to ensure that you know, those folks would have some continued connection with their communities, then it might be appropriate to consider a model different than the traditional nursing home model that we have now. So there is planning work being undertaken in the coming year, and we're going to look at best practices relative to this, look at people being able to remain in their communities and receive the level of care that they should in those circumstances. And the what's this? Right?
She asked a question.
Yeah. At any rate, that, you know, I think I've addressed the major concerns that you have brought forward, so we will be in a planning process, and we're always looking to. We're never static, and we try not to be, and we try to ensure that the best options for citizens in the long run are being made available, or we hope to be in a position to make them available as we move forward. Oh, seniors boarding homes are part of the system.
That's neat.
We'll have to send those department officials on a penmanship training session, eh? I want to thank the minister for that. I want to let the minister know that there's a member of my constituency who's lived here in Canada for many, many years and recently went back to England, where he was originally from as a young boy, for a visit. And while he was there, he was visiting with, I think he told me his sisters, who was in her 80s and was in a small residential care facility of some kind. And he picked up some information from the particular section of England that he was in that showed it was a kind of a directory of residential facilities and continuing care facilities in the UK. And they were all very small. They were, there was nothing that had more than, you know, maybe 34, 35 beds. Said that bad word, but that's how it looked. Yeah, that's how it appeared in the information. Anyway, it was he brought this in, and he was really quite excited about this idea of having smaller facilities. And he certainly is somebody that I got to know when his wife had to go into one of the larger nursing homes. And he used to go and visit her every day. And while he you know, certainly didn't have bad things or negative things to say about the care she was getting in the nursing home in terms of bad treatment, I think that he always felt that this large setting was a very difficult and maybe inappropriate setting for his for his wife. And it's certainly something that we hear all the time. I'm sure the minister must hear this, that as much as we've brought attention to the financial assessment and that whole process and having seniors have to pay for their health care, there certainly is a concern about standards of care and about trying to bring into our continuing care system the kinds of practices that are actually based on care and dignity and respect and a quality of life that we would all desire for ourselves and for our parents and for our loved ones. And so that brings me to some questions around standards of care. The current policy of the department with the single entry system is that you don't have really a lot of choice, maybe in many circumstances, which care facility you go into. There is a commitment to keep a family member, a person, within 100 kilometers of their family or home environment. But we have no real standards right now that require that spouses not be separated, for example. We have no, we may attempt in practice to be as flexible as we can, but there's no requirement, I guess, and there's no reassurance. So the system is more developed to facilitate the system in some ways than it is to facilitate what the individual member needs at any given time. So I want to ask the minister whether or not the department are planning on a rigorous review of standards of care and standards of practice that will involve the public and will involve all of those groups who are advocates with and for seniors and family caregivers, so that we can arrive at, I think, a modernized set of practices and standards that bring some of the social concerns and some of the human concerns back into a system that has sadly lost some of these considerations and has more often been reduced to ideas of efficiency and cost saving than about care.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair, and I do want to say to the honourable member that indeed we are embarking upon a province-wide consultation with people. It's related to standards of care and best practices that can be found, and of course it's best practices not just here, but elsewhere, as we are made aware of them. And the concept to which the honourable member refers relative to the situation in the UK and the smaller units is part of is a part of the philosophy of aging in place, and that is something that I know I had discussions with when the ministers responsible for seniors from across the country met here in the fall. It is something that we will continue to address at the national level, but we are also doing it here in the province. And it's obviously the closer that we can keep people, or first of all, the longer we can keep people in their own homes, and the more we can keep them, plugged into their communities, the better it is, not just for the individuals, but for families also. And I want to point out that the 100-kilometer rule is one that applies only to those who are in hospital. If you are making application from your home, then of course you have the option of being able to move to the home of your choice. And I know that I have dealt with a number of individuals and families who have called my constituency office, not in my capacity as Minister of Health, but over my term, most recent term here, and they were quite naturally concerned that the parent or loved one was going to be transferred some distance from either to Sherbrooke or to Guysborough or wherever, and we were able to assure them that in fact as soon as beds became available in Antigonish that they would be able to come back. And I can quite frankly say to the committee that I've not heard from these people again saying that what you said didn't happen, because in fact it did happen, and usually it happened reasonably promptly. But what's interesting also is that in some instances the people go to a home. It's not always to the satisfaction of the families involved, but they go to a home and they wind up liking it there. They find people that they know are there, or the service is good, and they wind up liking the environment, and they make a decision to say, well, no, I don't think I'll bother going back. I like it here. I'd like to stay here. That's possibly a function of people being resistant to moves, and and getting comfortable and saying, well, I'd like to stay this way. But to the broader question, consultation, most definitely.
Thank you. The Honourable Member for Halifax Needham.
Thank you. I want to thank the Minister. Of course, I know that when there is there's a body of literature research that I think pretty well establishes that multiple moves for seniors aren't good, and that in fact it can result in mortality in some cases. So I think it's something we do have to be concerned about. I want to ask, because I don't have a lot of time left in this particular time frame, I want to ask the Minister about a particular group, I guess I would say, for want of a better word, that don't necessarily belong in a discussion about long-term care, but end up in part in this discussion about long-term care because we don't have, I think, a well-thought-out policy with a commitment of resources to dealing with their particular needs. And this is people with brain injuries in Nova Scotia. And the Minister will be aware that the department had a working group on brain injury. There are a limited amount of options available for people with brain injuries. Sometimes people will be at the rehabilitation center for a period of rehabilitation services and therapies. Very, very expensive, but very much needed. But then where do they go from there? And sadly, people frequently end up in a long-term care facility. These individuals may be young people. They may be a young person who was in an automobile accident or an accident swimming, diving, or whatever. It could be a young mother. In the course of my time as a member of this legislature, I have had contact with a number of families who have young family members with brain injuries. They are, I think, justifiably beside themselves when the only option that is available to them is a long-term care facility where, without getting too maudlin, are often habited by people in the final stages of their life. Maybe seniors who have terminal illnesses, chronic diseases, and a limited ability to engage in certain kinds of activities. And yet here is this young person who has had this unfortunate accident, generally, or some other situation that has resulted in a serious brain injury. The lack of residential rehab facilities or options for persons with brain injuries in our province, I think, is regrettable, to say the least. And I understand that these services would be expensive. I've been to Peter's Place on the South Shore. It is a wonderful facility. And I know that it is expensive to be there. But Mr. Minister, you know, cardiac care surgery and health care is expensive, and cancer care is expensive. These services, they are expensive. So I'm very concerned that we have not moved at all, really, in terms of implementing any of the recommendations on the working group with respect to brain injury. We see no plan, no allocation of resources, no real political will to address what may be a very small number of people, but nevertheless, they are citizens of our province. They have the right to live as full a life as they can, given what their individual circumstances are. And generally speaking, in the right kind of environment, they in fact have the ability to really thrive and not sort of be strapped into a chair vegetating someplace in a long-term care facility. And I feel quite strongly about this issue, and I want to ask the minister why and why this has not been addressed, and when can we expect to see some movement with respect to the recommendations of the working group on brain injuries?
Thank you. The Honourable Minister of Health.
Thank you, Mr. Chair. The honourable member has inquired about a subject matter that is of concern. Obviously, the treatment of people with brain injuries, when the resources are found, will be an investment in terms of the long term, because it puts many of these people with proper sort of intervention, in fact, could wind up avoiding other care requirements in the future of their lives. And it is a discussion that I was involved in recently with the Disabled Persons Commission. It's an issue that's very important to them. And I can say that it's an issue of importance to the department. We obviously don't have unlimited funds, but we are taking the steps that are necessary for us to be able to proceed when funds become available. And indeed, if we do receive additional monies as a result of any discussions that may take place this summer, that would be an area that I know the department would like to address, and it's an area that I would be very comfortable in bringing forward to my colleagues with respect to addressing it, because and as the honourable member points out, it is a relatively small portion of our population, but it is a portion of the population where we could, in all likelihood, achieve long-term savings relative to these individuals. So we are developing the standards that are required with respect to these treatments, and we have some money this year in the budget with respect to the IWK, with respect to rehabilitation, which will address to some extent children's needs in this, and there will be some benefits flow from the stroke strategy, but it's not a full court press with respect to dealing with this matter, and it's anyway, one of the frustrating parts of this job is that there's all kinds of needs out there, and there aren't resources to meet all of them.
Thank you, Minister. The honourable member for Halifax Needham.
Very quickly, my last question before my time expires is with respect to diabetes and a program for low-income diabetics. I know that the Diabetes Society have every year for the past few years, they have really tried to educate members of the legislature about diabetes. It's a disease that is very prevalent in Nova Scotia, as you know, and particularly in some communities more so than others. To manage this disease, it can be quite a challenge because of the testing that's required on a daily basis to really keep very good track of insulin levels, and the strips and all of those kinds of aids that allow people to manage their diabetes is very expensive. So I can't find anywhere in the budget an allocation of money for a low-income diabetic program, and I want to ask the minister, have I missed something, or has there been a decision not to fund that?
Allow for an answer. Yes, honourable minister.
Mr. Chairman, and the commitment that was made was a commitment in the blueprint, and it was a commitment, a year 2 commitment with respect to government. We have met with the Diabetes Association. We've indicated that we want to work with them relative to the development of a program, and our objective is to have that program developed to the point where we would be able to implement it in the next year.
Thank you. I'll now recognize the honourable member for Halifax Citadel.
Thank you, Mr. Chairman, and thank you, Minister, for your comments. This must be quite an endurance challenge for you. I'm not sure if you prepare through some health promotion manner to get ready for these kinds of days. I'll bet you do. I see Minister MacDonald doing a mimicked trot as he sits in his chair. I'm not sure if that's a hint to you or to me in the circumstances. Some of the questions that I am going to be asking, Mr. Chair, will relate in part to health and health promotion. Some of the questions are somewhat historical, and in the circumstances, there is an overlap, as we all know, with respect to health and health promotion, and perhaps we can proceed accordingly. Squarely on the question of health, first I would like to raise with you, Minister, the issue of the Cape Breton Wellness Centre. You'll recall that on a number of occasions this issue has has been raised by members of our caucus. The Cape Breton Wellness Centre is an award-winning organization out of Cape Breton, and I'm just asking the minister if he's aware of the funding challenges connected to it in relation to cuts that happened back in 2002.
Thank you. The Honourable Minister of Health.
Mr. Chairman, I first of all would want to say to the honourable member that that my knowledge of the issue is not expansive. It's an item I understand that on two budgets ago would have dealt with the decline in funding for that particular facility, and it's not something that entered into our discussions relative to the preparation of this budget.
Yes, the Honourable Member for Halifax Citadel.
Mr. Chair, I would point out that the Cape Breton Wellness Centre has been in existence for many years, and it is an award-winning organization. In fact, back in 2002, the Cape Breton Wellness Centre received a Leadership Award for Women's Health in Atlantic Canada from the Atlantic Centre of Excellence for Women's Health. My question for the minister relates to the kinds of things that they promote, and the preamble to this, Mr. Chair, will be lengthy. The Cape Breton Wellness Centre initiated the Healthy School Food Policy. It is involved in screening women accessing cervical cancer. It is involved in research into how recent coal mine closures are affecting the health of people living in Cape Breton. It is working on a plan for the development of bikeways, pathways, green spaces that support and encourage active living. It speaks about increasing access to quality teen parenting education, talks about post-rehabilitation cardiac patients, and it has spearheaded the Economy and Health Project. Mr. Chair, these are all issues that are directly connected to the #1 phrase that is in the healthcare system these days, and that is population health. 2 years ago, this government cut funding to the Cape Breton Wellness Centre to the tune of $150,000, and despite pleas on the part of that organization, has failed to reinstate it. My question for the minister is, when will that funding be reinstated?
The Honourable Minister of Health.
Thank you very much, Mr. Chairman. As I listen to the description that the honourable member provides of that particular facility, and as I consider what those issues are related to, it's probably a question that the member might want to present to the Minister of Health Promotions when his budgets are before the committee. Because while that office did not exist at the time the decision was taken, if any change relative to those decisions were to occur, they would occur under the auspices of his budget line.
Thank you, Minister. The Honourable Member for Halifax Citadel.
Mr. Chair, I would dare to say that there is an overlap here. The funding was cut from the Department of Health. The Department of Health is directly involved in issues related to primary health care. It's directly related to charting out a vision for population health. It's not just with the Office of Health Promotion. It is squarely a responsibility that exists in the Department of Health. The $150,000 is missing, and this organization has continued to try to scramble to find support through other means. Surely when we're talking about screening women for cervical cancer, and post-rehabilitation cardiac patients. Those are issues related to matters under this minister's portfolio. I appreciate that if there are other concerns, for example, that relate to bikeways and pathways, that's more directly related to the minister responsible for the Office of Health Promotion. But these seem to be clearly matters under the Department of Health's auspices. If the money is going to flow, surely it will come from the $2+ billion that goes into the Department of Health.
Thank you, member. The Honourable Minister of Health.
Thank you, Mr. Chairman. My understanding, as a result of this discussion going on and learning more about it, is that the funding that was provided to that facility was funding in the form of grant funding, and I understand that it was provided. The anticipation was that the facility would become independent and be able to carry on operations on its own once some funding was provided for a period of time. That did not materialize. It did not realize its own objectives of being able to become independent, and the decision was taken at that time.
Thank you, Minister. The Honourable Member for Halifax Citadel.
Mr. Chair, I'd like to continue on the issue with respect to the Cape Breton Wellness Centre because it relates directly to whether or not we're able to move forward. And if we continue to wrap things into silos of whether it's a grant or whether or not there's an obligation to have continuing funding, then we're never going to get to where we need to be when we have an organization like this that has been so successful in the most important areas of healthcare. So often we hear the comments these days about how it's not just about healthcare, it's about health. And I was commenting earlier today about how so often we seem to be taking people after they've become ill, and we haven't been doing a good enough job in preventing illness. And in Nova Scotia, it's arguable that our record is perhaps the worst record of any province in this country. And the need for us to move to a greater focus on health promotion and illness prevention is greater than any other province in this country. If one were to look, for example, at the statistics, and I know that the minister has heard this over and over, but it bears repeating, that in Nova Scotia we have the highest rate of death from cancer. That's strongly linked to smoking. We have the highest rate of death from respiratory disease. We have the second highest rate of death from lung cancer. We have the highest rate of death from circulatory problems. We have the highest rate of several preventable chronic diseases and the highest reported number of disability days in Canada. Nova Scotia develops a health disability at an earlier age and suffers with it longer than do other Canadians. Nova Scotians do. And what's most troubling about that, Mr. Chair, is that in Cape Breton, the problem is far worse than it is for the general population in Nova Scotia. So if there is an area of this province that requires the greatest attention with respect to wellness and health promotion, clearly it is in Cape Breton. Recent studies done through Health Canada and through GPI Atlantic, that I'm sure the minister is familiar with, suggest that of the several hundred districts that were measured for health, population health in Canada, Cape Breton has consistently ranked near the bottom. Now we have an organization that is doing tremendous work exactly in the areas that are supposed to promote health, and a measly $150,000 is not being provided to that group as a consequence of this government finding other priorities in the Department of Health. My question for the minister, Mr. Chair, is whether or not this minister will agree to sit down with officials from the Cape Breton Wellness Centre to have a discussion on whether or not that $150,000 can be reinstated.
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chairman. And I must say that this is the first time that in my capacity as Minister of Health that this particular issue has been presented to me. And there are two elements that must be considered relative to his request. And one is that, as he has agreed, many elements of the activity of that Cabritton Wellness Centre would fall under the jurisdiction of the Office of Health Promotion. But the other is that the District Health Authority have an interest in providing that and in seeing that level of service is provided within their jurisdiction. So what I will say to the honourable member is that I will request that the Minister of Health Promotion and the District Health Authority and myself review that particular institution and see that there is a communication that takes place with them relative to how their services would fit with respect to the objectives of not just the Department of Health, but the District Health Authority and the Office of Health Promotion.
Thank you, Minister. The honourable member for Halifax Citadel.
Take that as an undertaking that we at least follow up with to explore this issue. I see the Minister nodding that he's at least willing to explore it. Where the responsibility ultimately rests is something to be decided at a later date between the Minister of Health's Department, the Office of Health Promotion, and the District Health Authority, and I thank him for that. The next issue that I would like to touch on relates to the issue of taxes and specifically tobacco taxes. I would draw the Minister's attention, if you would, to page A15 from the budget that was tabled in the House last week. In that, the heading at page A15 is revenue sources, and I'd like to talk about a few of these because frankly they relate quite directly to the health of Nova Scotians. We have the issue of tobacco taxes indicated in 2002-2003 having been $145,425,000, rising to an estimate just 2 years later of $180,217,000. We also have liquor corporation profits that were $157 million, rising to $181 in this coming year. We have the gaming corporation profits that were $187 in 2002-2003, dropping to the present time, 2004-2005, of $169,000. Now, if I could focus first on the very troubling issue of smoking and tobacco costs, Mr. Chair, back on the first occasion in April of 2001, April 5th, 2001, in fact, this government raised tobacco taxes and did it largely under the name of improving the health of Nova Scotians. And then in November of 2001, just about 8 months later, they did the same thing and raised many millions of dollars more. On January 8th, 2003, tobacco taxes rose once again. On March 16th, 2004, tobacco taxes rose once again. Now, on at least the last couple of those occasions, the question was put out as to whether or not the money from those increased taxes were going to go into improving the health of Nova Scotians. Since, after all, at least in these 4 press releases that I've referenced, and I'm happy to table them if necessary before the House, the increased tobacco tax came as a result of the government's concern for the health of Nova Scotians. Our calculations determine that the total amount that has been raised is in the range of $90 million. And the amount of money that has been put back first into tobacco, the tobacco strategy, has been in the range of $2 million. However, approximately 3% of the total value of the money that was taken out in the first place. And we see, and some small credit is due to the recent announcement about improvements in the area of health promotion, and they will deal with smoking cessation. But surely, the minister responsible for the good health of Nova Scotians is able to provide this House and this committee with a a clear indication of where the 80-some million dollars that was raised in the name of better health for Nova Scotians has gone from the tobacco taxes that have been placed on Nova Scotians since 2001?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chairman. I believe that an analysis of the costs associated with the treatment of lung cancer itself would reveal that the cost of providing that service to Nova Scotians is indeed in excess of the amount of money that's raised through tobacco taxes, and that's the challenge that faces the people of this province relative to the treatment of illnesses. He referenced the Liquor Corporation. The money that's raised through the taxes in the Liquor Corporation are not sufficient to treat all of the social costs associated with the abuse of alcohol. So that's a reality that faces the province. We indeed are reallocating resources to health promotion and to tobacco cessation. We've reduced the consumption of tobacco by 5%, and indeed the increase in the cost of tobacco is a factor in the reduction of consumptions. It plays a very definite role in that reduction of consumption, and that relates directly to the issue of health. But the challenge that exists for Nova Scotians is the challenge of meeting the costs of treatment and providing the health care, and those revenues don't do the job in and of themselves.
Honourable Member for Halifax Citadel.
Thank you, Mr. Chair. I'm wondering if the Minister of Health would be able to provide us with statistics that support the assertions that he's just put forward.
The Honourable Minister of Health.
The answer is yes.
Thank you. The Honourable Member for Halifax Citadel.
Just to be clear, Mr. Chair, I want to be certain that he made reference to both the lung cancer and the cost of lung cancer, and he also made reference to the cost of alcohol consumption. Is the undertaking with respect to both of those taxes and the costs in relation to both of those?
Thank you, Minister. The Honourable Minister of Health.
Thank you, Mr. Chairman. The issue related to lung cancer, and I included in that as well I should have included in my words cardiovascular disease. We can provide those statistics. I would have to say that my reference to the revenues from alcohol taxes are based on figures that I assume to be true from some considerable time in the past, and I don't know if I can put my fingers on the most recent statistics relative to that, but I feel fairly comfortable that we're coming very close to describing the situation. But we will provide definite statistics relative to the treatment of diseases, in particular lung cancer and cardiovascular disease related to the revenues derived from tobacco consumption.
Thank you, Minister. The Honourable Member for Halifax Citadel.
Mr. Chair, the concern that I have about the response, and I accept the response at face value that the Minister has provided, however, is that the treatment is not ultimately going to get us to where we need to be. The secret to ensuring that Nova Scotia is healthier and that the costs are reduced are clearly in the areas of prevention, disease prevention and health promotion. And I'll provide a reference for the next comments that I have. Statistics Canada, CANSIM database, matrix 3783, indicates that only 2% of our healthcare budget is devoted to disease prevention and health promotion. My question for the Honourable Minister of Health is whether or not he believes that 2% as a percentage is sufficient in 2004.
Minister of Health.
Thank you, Mr. Chairman. And the honourable member is referencing the need for us to be involved in healthy living and promoting healthy lifestyles in this province. That's clearly a commitment that's understood by this government. That is why the Office of Health Promotion was created. That is why we have provided additional monies to the Office of Health Promotion this year, increased the budget by, I believe, 24%. So I was interviewed earlier today if all of a sudden we were able to come forward with an amount of $90 million tomorrow to put into health promotion. The question is whether or not we would have the human resources to be able to suddenly do that. It's something that we need to be able to ramp up gradually, and we're doing that. There was a very good year of planning, went into levels of activity. Today, if you look at Healthy Nova Scotia, it's another plan that's intended to achieve that particular objective. Mr. Chairman, what we're really involved in this whole initiative is to alter the culture of Nova Scotians. And I have considerable faith that we can achieve the objective of altering the culture of Nova Scotians relative to healthy living. In the same way that we're able to affect the culture of Nova Scotians with respect to issues like recycling. Where this province, under a program initiated by the previous Liberal government and set forward by that government through the efforts of the Resource Recovery Fund, they set an objective to achieve a 50% recycling of resources, consumed resources in this province, and that objective. I happened to be the Minister of Environment at the time that it was the objective was achieved, but it was set out by the previous government, and I gave them credit at the time as a very worthy program. But what was significant about it is the way in which the culture of Nova Scotians relative to the issue of recycling was altered and changed. And that is something that I believe we can do relative to the issue of health promotion. But it's not something that's going to be achieved by suddenly throwing huge sums of money. We need to build and gradually develop momentum and awareness, and I believe we're moving in the right direction with respect to achieving this. Thank you, Mr. Chairman.
Thank you, Minister. The Honourable Member for Halifax Citadel.
Thank you, Mr. Chair. One can appreciate, Mr. Chair, that this isn't a matter of suddenly making changes overnight. One can appreciate that these changes happen gradually, and I think that the government understands that it's ultimately about changing the culture. But in order to change the culture, an injection of resources is required. I'm sure that the minister has heard a lot about the North Karelia program in Finland, where a population in a province in Finland suffered terribly from chronic diseases. And that government committed the resources necessary to ensure that the people became healthier. And as a result of that concerted effort to address the problems of chronic disease in North Karelia, Finland, there has been a substantial improvement in the population of the health of the people overall. Now, I made reference a moment ago to the fact that according to Stats Canada, only 2% of the healthcare budget in Nova Scotia goes toward disease prevention and health promotion. What's interesting to note about the budget that has been placed before this House on this occasion is that there has been $3.6 million that has been devoted as additional funds toward the issue of health promotion. Now, when one takes that additional money and compares it to the $230 million worth of new money that is coming in for health care, we note that despite all the bluster about focusing more on health promotion, that 3.6% of additional money doesn't even represent 2% of the additional money globally that's happening. So it's a question of whether or not this government is prepared to walk the talk when it comes to the issue of health promotion. in comparison to $230 million of increased funding for the healthcare machine generally, to put only $3.6 million into the issues of health promotion is, I would suggest, completely substandard. And while the minister says that we're going to build this thing gradually, surely there are bold steps that need to be taken. And I'm going to suggest just a small step and a bolder step for the minister to perhaps consider and to respond to. The first is that there is a program with respect to smoke-free students in Nova Scotia that's recognized by Health Canada as one of the most impressive programs of its kind. I believe it's called Smoke Free for Life. Unfortunately, research has suggested that less than 20% of the students in Nova Scotia schools benefit from the education that comes from this program. What would it cost for 100% of the students in our province to receive the Smoke Free for Life program at the critical age when they're forming their values around smoking and the choice of smoking in their lives? Health Canada recognizes it as a great program. Very little money is committed to it. Those are the small measures I would suggest, and I'd invite the minister to respond to that. And if I could go to a bigger one, Mr. Chair, it relates to something that I've been beating the drum about for 2 years now, and that's the Healthy Starts initiative that is much talked about, where there's not nearly sufficient action on in this province. All of the research tells us that if somebody's going to have a happy, fulfilled, successful life, the most important years of our lives are from the period from prenatal to grade primary. We have a program in this province that initially was worth $9 million. Almost all of the money in relation to that came from the federal government. The provincial government has started to add nickels and dimes from time to time, but have not nearly stepped up in the way that they need to step up to ensure that all of the children who are at risk from the time they were born and even when their mothers are pregnant are getting the kind of attention that they need to ensure that when they reach grade primary, they have a leg up on life and that they're not suffering. That, Mr. Minister, requires not nickels and dimes. That requires a real commitment to the promotion of the health of the people in this province. And if we'd follow the research, we'd realize that if we're going to have a healthier Nova Scotia, it needs to start with the children who are from 0 to 6 right now. And putting money, not nickels and dimes like the $3.6 million, but a big chunk of that $230 million additional dollars toward truly promoting the health and preventing illness in this province.
Thank you. The Honourable Minister of Health.
Thank you, Mr. Chairman. The Early Childhood Development program to which the honourable member referred is indeed a priority of government, and it's worked on between the Department of Health and the Department of Community Services. It's resulted in additional public health nurses being available throughout the province, and they, of course, work with newborns and prenatal activities up to age 2. So, you know, that is something. But, Mr. Chairman, I also want to point out that the North Karelia project, which was referenced by the honourable member and the honourable member for Victoria the Lakes previously, the effective strategies and that come out of that particular project have played a key role in the development of the chronic disease prevention strategy of this province. So we're very much aware of that particular project, and honourable members have indeed referenced the fact that the results in that project were not results that were achieved in a very short period of time, but they took a considerable period of time to achieve the objectives that are heralded when that program is referenced. So by this province putting in place the chronic disease prevention strategy and the implementing of that strategy, we indeed will achieve similar results, if not improved results. And I have every confidence that we can do that. Mr. Chairman, I appreciate the concern relative to the issue of health and health promotions, but I do note that for the past number of minutes, most of the time that I've spent is in relation to the Office of Health Promotion budget, which I believe if members wanted that particular motion to be debated in the Assembly, it's one that they should have called to have brought forward in the Assembly so the debate could take place with the appropriate minister.
Thank you, Minister. Honourable Member for Halifax Citadel.
Thank you, Mr. Chair. I'd like to turn my attention to the issue that is related to this, related to the budget line items, and in response to the minister's comments just now about whether or not this is his responsibility or the responsibility of the minister responsible for health promotion, he can be certain that if and when the minister responsible for health promotion appears before this committee to defend his estimates, then we will be asking him similar kinds of questions. I think it is prudent of us to ensure that these questions are asked squarely of both ministers. Now, Mr. Chair, I'd like to turn my attention to the issue of gambling addictions. And I made reference earlier in my comments to the fact that we estimate in next year that Nova Scotia will receive the Nova Scotia government will receive $169 million from gambling corporation profits. I would ask the minister to provide this House with an indication of what he understands to be the commitment, financial commitment, in this coming fiscal year toward gambling cessation programs and gambling addiction.
Thank you. The Honourable Minister of Health.
Thank you, Mr. Chairman. That clearly is a question that is appropriate for the Minister of the Office of Health Promotion. It is not something that for which I have administrative responsibility, or is it a part of the vote that will be applied to my department?
Thank you, Minister. The Honourable Member for Halifax Citadel.
Thank you, Mr. Chair. One of the frustrations that one has when they're dealing with the Office of Health Promotion is that one is left with the impression that they are always hoping for more money. I can recall the discussions that happened 14 months ago with respect to many of the issues that are connected to health promotion, and at that time the minister did not have a budget and did not have an office. Eventually various components of government services were cobbled together and a budget was assembled as a result of the merging of the budgets of those various groups, and a budget was ultimately found. We do believe, of course, that the issue of gambling and the number of people who are affected by that, the families who are affected by that, and frankly, the suicides that, according to the research, happen in Nova Scotia every year are health-related matters. We have circumstances where this province is prepared to put money into communication strategies and advertising to ensure that smoking does not continue. But with respect to gambling, there's hardly any money that is provided to that area. And my question for the Minister of Health is whether or not his department would even consider, in light of the number of deaths and how this affects the wellness of Nova Scotians, his government would consider the possibility of contributing to a more aggressive, in this fiscal year, a more aggressive campaign to ensure that gambling is substantially reduced in Nova Scotia.
Thank you. The Honourable Minister of Health.
Thank you, Mr. Chairman. The responsibility the department has with respect to the treatment of gambling is something that's provided through the district health authorities, and we provide through their business plans appropriate monies to assist them in providing that service. And I'm told that is an amount of $19.8 million, but that is for the treatment. The honourable member is asking about prevention, and again, Mr. Chairman, I would submit that questions related to the prevention of gambling are appropriate to put to the Minister of the Office of Health Promotion, because the monies dedicated to that activity are monies that come under his vote and not mine.
Thank you, Minister. The honourable member from Halifax Citadel.
Mr. Chair, my questions now relate to the New Waterford Consolidated Hospital. The minister is quite familiar with the challenges that have been faced by several families in that area. We know, of course, that through the District Health Authority, an inquiry was made. Ms. Smith, if I believe, Dr. Smith was retained, and now the position of the government is that it's not a responsibility of the government to provide compensation in these particular circumstances. I want to ask as a general question, first of all, where does the Minister of Health see this matter resting at this particular time?
Thank you. The Honourable Minister of Health on that question.
Perhaps, Mr. Chairman, the indulgence of the honourable member, he could be more specific in terms of the direction of his question, because to answer it now, I'm just not sure what the focus is.
Thank you. Could you be more specific, member?
Mr. Chair, the minister will be aware, of course, that our party has called for a public inquiry with respect to the New Waterford Consolidated Hospital. We have in that community several people, including families that have babies who were in vitro at the time that construction was happening approximately 2 years ago at the New Waterford Hospital, who have particularly high levels of metal poisoning. Those families continue to say that they are aggrieved. People have lost their work. There is obviously a need from a health perspective to get to the bottom of this problem, and despite the fact that the Department of Health and the District Health Authority is claiming that it's not related to the construction period that was happening 2 years ago, the families certainly don't accept that as an explanation. And I know that the Department of Health has and the District Health Authority said we think we have some idea of what the cause of this problem is, but certainly my recollection, Mr. Chair, is that there is no certainty. There's been no definitive conclusion drawn with respect to what is the cause of these problems, and I'm asking the Minister if he could elaborate.
Thank you, member. The Honourable Minister of Health.
Yeah. Thank you very much, Mr. Chairman, and I thank the honourable member for his clarification and the focus that he brings to his question. The priority of government and the District Health Authority, and of course occupational health and safety committees in that area, is to try and determine the specific causes of the illnesses being experienced by the individuals in that area. And that is why, as a follow-up to the report of Dr. Smith, to which the honourable member referred, Dr. Ted Haynes will be in the area tomorrow. It's my understanding that he'll be there tomorrow. And we have encouraged people who are experiencing symptoms to visit with Dr. Haynes. I know that he has spent considerable time in preparation for his visit in terms of reviewing the files, reviewing the cases of individuals who have indicated a desire to meet with him, so that it is not I want to make sure that people don't feel that this is a one-day activity on his part. He has invested a considerable amount of time to date relative to an examination of this. The objective is, again, to further and see if we can find in a more definitive way the causes of the illnesses that are being experienced by people in that area. The District Health Authority has determined that there are ventilation problems in that hospital, and steps are being taken, first of all, from a design perspective, and I understand there has been some real progress relative to the design, and that the District Health Authority in the near future will be able to come forward with a proposal with respect to improving the ventilation in that building, and that will assist in an improvement of the situation at that hospital. So we're awaiting the